Back of the knee pain, also called posterior knee pain, can affect individuals at any time of life. The most common and obvious cause of knee pain is trauma or injury, fractures, sprains, strains, and tears that occur in the muscles, tendons, ligaments, and cartilage. These, of course, happen most often during sports competition, falls, or vehicle accidents. Arthritis is often the cause of knee pain in those over the age of 50. Wear and tear through the years can result in pain and stiffness caused by inflammation and irritation. Pain from arthritis in its various forms tends to be more noticeable in the morning as you wake up. There's also a condition known as a Baker's cyst, named for William Morant Baker, the 19th century doctor who first described the condition. It occurs when a fluid-filled sac called the popliteal bursa becomes irritated or inflamed. In other words, it's a form of bursitis. Baker's cyst is usually the result of arthritis, injury, or excessive repetitive motion. Overuse of the knee joint during exercise or as part of certain professions is another cause of Baker's cyst. Blood clots are among the most dangerous causes of pain in the back of the knee. Clots tend to occur frequently in people who must lie in bed for long periods, like hospital patients. But just sitting in one place for a long time, like a transcontinental flight, can be risky. Other causes include advancing age and obesity. Blood clots can block circulation in veins and arteries. Other symptoms you may notice when you have a problem that causes pain in the back of your knee include swelling, a lump or bulge in the back of the knee joint, a clicking sound or sensation when the knee moves, a feeling that your knee is locking. Treatment for pain in the back of the knee depends on the cause and source of the discomfort. I hope this video has been helpful, but remember, you should only rely on a medical professional to diagnose any problem or concern about your health. I've produced a number of other YouTube videos related to knee problems. You can click on the links below to view them.